Hi, everyone. Thank you for joining us today for the Talent Mobility webinar hosted by Sperton. We'll be talking about unlocking employment opportunities in Europe for healthcare professionals, so all of you guys. So before we get started, we have some very exciting guest speakers. We have some very exciting content that we would like to share with all of you. But before we get started, let's talk about some of the ways that we're going to be doing this. So if you guys can direct your attention to the top like slight corner of the screen, there's a function called Q&A function. Please make sure to use that whenever you have any questions, either for me, for Kousain, for any of our guests. And yeah, that's for the questions. And feel free to use the chat or the emojis in order to react or to interact with us speakers when we're talking about specific things. Now, let's move on to the agendas. So before we start everything, we'll be giving you guys a little bit about introduction to everyone who will be speaking today, what we've done, who we are, and then I'm going to be presenting to you guys about the healthcare needs in Europe. More specifically, I'll be giving you guys a little bit about and a little insight into the European healthcare sector and the in-demand healthcare related jobs in Europe. Furthermore, after that, we will be having a panel discussion where we'll be engaging some of the guest speakers that we have today to talk about the initial transition process of, foreign doctors like yourselves coming into Europe, what it's like working in Europe as a foreigner or as someone who's not necessarily a national, what challenges you might face, and also what are some of the future prospects as a healthcare employee here in Europe. Lastly, we will be giving you guys a little bit of an introduction to Sperton, who we are, what we do, and we will have a Q&A session where we will be addressing as many of the questions as we can that you will be submitting through the Q&A function. So make sure, once again, to send us any questions that you have through the Q&A function. Now, let's get started with the speaker introductions. Now, Kousain, if
Perfect.
you could tell us a little bit more about yourself, a little bit about yourself.
Wonderful. Thank you, Jihun, first of all, for getting this started. So, a quick introduction about myself. My name is Kousain. I'm an HR professional with well over 13 years of experience working in several industries, including energy, IT, healthcare sector. I am currently working in Sperton as a country and people manager for Germany, looking after the markets in Europe, specifically the German-speaking region that includes Germany, Switzerland, and Austria. I have been supporting companies in terms of finding the right talent, getting them on board, managing the complete employee life cycle. This includes different aspects when we talk about human resources, employees, their payroll, global mobility, in terms of learning and development, employee talent acquisition. So I've been doing pretty much my career in human resources. Yeah, so that was a quick rundown from my side. Thanks, Joan. Over to you.
Thank you, Hossein. Now a little bit about me. I just currently finished my Bachelor in International Business Administration and am currently engaged with Sperton as a talent acquisition analyst. I'm very involved in the process here with the talent mobility program that we have, and I have several amazing experiences working here with some here in Germany, working with some companies such as OHB SE, Topaz, and Enkoi. Um, I'm specialized here in HR practices and market research and market analysis. Now, Dr. Noor Mshani, if you could tell us a little bit about yourself.
Hi, yes, my name is Imshani. I am a doctor working since 7 years in Germany. I have done my medical degree in Bucharest, the capital city of Romania, and came to Germany to start my specialization as an internal medicine doctor. I have finished my internal medicine specialty in February this year, and now I'm pursuing to become a cardiologist.
Thank you, Dr. Noor. Dr. Mariam Zara?
Yeah, hi. I'm basically a doctor from Pakistan. I did my graduation from Dow Medical College, and then I did my FCPS in pediatrics recently. And around a month back, I moved to Denmark to pursue my career further. Thank you.
Thank you,
Perfect.
Dr. Mariam. Now, let me tell you guys a little bit about the healthcare needs in Europe. So first, let's talk about something very important, life expectancy. This is a very major problem, not only in Europe or Germany or countries here, but also worldwide. As you guys can see, starting from the 1700s all the way to the 1900s, life expectancy was very stable around 30 to 40 years. However, throughout the past few years, with the advancement of not only technology but also medical techniques, it has been slowly but surely increasing all the way up to over 70 to 80 years. This is a very good thing for the development of our society. However, it has some untold consequences in our society, including some that affect our healthcare sector. As you guys can see, currently, this is a chart from 2020. It shows the population within Europe in 2020 for females on the left side and males on the right side. The population for the females and males in 2020 is outlined with the unfilled boxes that can be seen. And the colored boxes are actually the expected population within the next 20 to 30 years. So in 2050. One thing that you can tell right away is that there is a very big amount of population currently concentrated, or in 2020 concentrated, around the 35 to the 60 years. That is where our population is the most concentrated in. However, that population is expected to move within the next 20 to 30 years up to the 65 to the 85-year zone. This is due not only to, as we saw before, the life expectancy that has been increasing, and therefore people will be living longer lives, but also because of several other factors. Some include the fertility rates that are at an all-time low, which has been there have been several initiatives from the from EU countries as well as worldwide to supplement this through foreign intervention. However, it is a very major problem where the age gap of the potential future population is mainly concentrated amongst senior citizens. And this especially has a devastating effects for the healthcare sector, because that means that there will be a lot more people necessary within the healthcare sector necessary in order to help and in order to give elderly care for those people who are at that age range. According to Khaliq, who is from the European Health Forum Gasten in 2023, we could face a crippling shortage of nearly 1.8 million healthcare workers, and those numbers are only growing. In some countries, there are just 2.4 doctors for every 1,000 people. Now, you might not understand this at first, but if I put that into perspective, in Europe and Central America worldwide, the average doctor per every 1,000 people is around 5 doctors per 1,000 people. And that just comes to show how 2.4 doctors is very, very few for every 1,000 people in a country. So let's look at some more specific examples. In Denmark, the government has explicitly stated and calculated that within the next 15 years or within the next 15, 20 years, they will likely face a shortage of 15,000 doctors. And this is just in Denmark. They state that the labor shortage is by far the biggest problem for our health system and elderly care. So it makes no sense for us to get in the way of skilled foreign healthcare professionals who want to work in Denmark. This comes to show how they already are starting to realize that it is imperative that they receive help from foreign healthcare professionals to come. They rely on foreign healthcare professionals to come into their labor market, their healthcare sector, and help them with their shortage issues. Another example that we can see is in Germany. In fact, Germany has already started to implement specific programs that help them bring foreign nationals within Germany, foreign healthcare professional nationals into Germany in order to supplement their growing shortage of healthcare professionals. As you guys can see from this chart released from the German federal government, in 2015, the percentage of German nationals that were in the healthcare system for elderly care was 92%. However, within 5 years, in 2020, it decreased dramatically to 85%, and the foreign nationals increased all the way to 15%. This can also be seen from nursing care, which where the proportions of foreign nationals grew from a 5% to a staggering 9%. And this percentage is just expected to grow bigger and bigger in order to supply the growing demand in healthcare professionals within Germany, as well as other European countries. Now, let's take a look at a more broader impact of the shortage of healthcare professionals. Because the truth is that healthcare professional shortage is not something that only affects Europe, but also the entire world, including USA and the UAE, which are very attractive as well when it comes to, seeking employment as a healthcare professional, as a healthcare professionals. So in order to make this comparison more easily seeable, we've created a sheet where we've created a comparison where you can see the difference in salary, the qualifications, the working hours, and the mobility. So let's start with salary. In Europe, the average salary for doctors is $8,600 US dollars per month. In the USA, this amount is $13,000, and in the UAE, it's $6,261 per month, which is a bit less than Europe, but the USA is obviously much higher. However, there is something that we have to consider, which is the fact that there are some factors that might influence how much of this salary actually comes into your pocket. This includes things such as living expenses, which in this case, USA has a much higher living expense rate in comparison to Europe. Another thing that we can look at are the qualifications. In the case of Europe, because it is made up of several different countries, the process of receiving recognition for your certifications and your work qualifications are different depending on which European country you're applying to. However, in the USA, you have to pass a very tough test called the USMLE. And not only do you have to pass this tough test, the grade that you receive for this test actually dictates the type of specialization you will be limited to within the US market. Furthermore, in order to work as a healthcare professional in the USA, you will have to participate in a residency program. On the other hand, in the UAE, you will have to pass the DHA exam and you have to have at least 2 years of medical experience. Let's talk about working hours. Europe and UAE actually have the same average of 48 hours per week when it comes to the working hours. However, the USA has a 3 hour difference in average, of course, where where physicians work 51 hours average mean, which is the reported amount. In terms of mobility, however, Europe has much higher mobility in comparison to the USA and UAE because of their flexibility. Because they are Europe, because of their collaborative entity as Europe, it allows for you to be able, as long as you get your degree recognized in one European country, that certification, that qualification that you've received from that specific European country can be flexibly transitioned to another European country. This makes it very easy for you to mobilize between one European country to another. This is, however, limited in the USA, where you might not necessarily have your qualifications transferred to another country, even if you do go through their initial qualification phase, as well as the UAE, where the qualification is mostly recognized with the exam that they take, the DHA exam that you pass will mostly only be recognized within the UAE. Now, Kousain will talk to you guys a little bit about the talent landscape within the healthcare professionals and give you guys an insight into that.
Perfect. Thank you so much, Jihun, for the insightful information. This is coming from an extensive research that we at Sperton had done over the past several months, where we have analyzed different markets, the trends that we can already foresee in the upcoming future, the challenges that will be faced, specifically, let's say, within Europe, within different markets within Europe. And since Europe consists of several countries, there are challenges faced on different level. This would be different for the regions in Scandinavia, the Nordics, Eastern Europe, Western Europe, and things and different areas. So what I would be talking about is specifically some of the insights for Denmark and in the broader European region as well. So talking about specifically, let's say, doctors at this point in time. So what we had done is we actually looked upon that. First of all, there are varied level of doctors, different specialities within doctors as well. We wanted to look at what are the requirements at this current point in time for the doctors. So if you would see this report specifically for Denmark, you can already see that there are people, professionals that are concentrated in the area of Copenhagen. There are, of course, a number of doctors that are working there. Some of the important job titles that doctors hold within this region are senior physicians, medical doctors, attending physicians, staff physicians. We not only took the general physicians, we looked upon as people who are dentists as well, people who are working on different segments within the doctors. And we wanted to see that which of the hospitals or public institutions, private institutions are hiring. And is the trend that we are foreseeing for the future, is that something that prevails at the present time as well? So as you would see in this, that just an example of 5 hospitals at this point in time, these are public institutions, they are on a hiring spree. So they are hiring at a rate of 7% within the last year. This hospital, that is RS Universitets Hospital, is been hiring at 11, is been growing with an 11% increase. The next hospital is already growing at a 10% increase. That means that every year the need of healthcare professionals, specifically doctors, is increasing. Not only for doctors, we looked at nurses as well. So are nurses required as well? And the demand actually is, I would say the numbers are much higher, although the percentages might look lower here. But the thing is that, the nurses that are working in the healthcare system are far more than the numbers of doctors that are there in the healthcare system. So This report that we ran was again for Denmark. And as you would see that, there are far higher number of nurses that are currently working. Some of the nurses that are being required are nurses, nurse practitioners, nurses working in the intensive care, nurses working at a higher level as lead nurses, specialists. And again, when we look at some of the hospitals, so they are on hiring as well. At 3% increase over the last year, this hospital is hiring at growing at a 5% increase. What does this translate us? Because there are, of course, too many professions within the healthcare sector as well. We did an extensive research to identify that which professions, which specialities within the healthcare sector are being required. And this actually help us identify a lot of areas. So this includes medical doctors, dentists, nurses, clinical dental technicians, dental hygienists, social assistant, healthcare assistants in one family. On the other family, when we talk about, let's say, lab automation, or let's say different areas within a hospital, so you would see that we also require emergency medical technicians, medical laboratory technicians, optometrists, people who are working on prosthetists, prosthetists, also working people in midwives, midwife nurses, chiropractics, uh, prescribing pharmacists, occupational therapists. So there are all of these segments within the healthcare sector where there's a growing demand, where there's an existing demand as well as a growing demand as well, where healthcare professionals are needed. So it just does not only restricts to doctors or let's say dental surgeons, dentists, but moving from all the people who are working, let's say, supporting operations in an hospital, people who are working as nurses, people who are working as in the labs, in radiology departments, who are working as technicians within those labs. So all of those areas, people are being required. Healthcare professionals are being required. Moving on to then now the next stage in our discussion. So this would be where we would want to include Dr. Noor, Dr. Mariam as well. Thank you, first of all, for joining in for today's conversation and taking your time out from a busy schedule, of course. So we would like to know more from your side as well, what you can enlighten us about your experiences and getting this conversation a bit more enriching. So I think I would start with Dr. Zara, Dr. Mariam Zara. As you have mentioned that you have recently joined us in Scandinavia, in Denmark. So if I would start with, so what was your first impression being in Europe?
Oh, thank you, Kousain. My first impression was basically, you can say it was similar to a person who has been born and who has been raised in a third world country and is always having a desire to move to Europe. So definitely, it was a very positive experience, and it was a very good experience, you can say, when I moved here.
Okay, I would of course say that we are developing nations, like there are definitely developing nations within different regions, and then we strive to go into um, gone through that phase, and we look forward that how the practices in Germany or in Europe or in the US, we should have those in the next few years as well, specifically in Pakistan. If I were
Yes,
to ask, so as you have now successfully landed, going through that phase of integration within the community. So, what were the initial processes like? Was it too complicated? What were the initial stages that you had to go through?
well, it was not very much complicated because, as it has been previously mentioned in the presentation as well, that there is a growing demand for doctors and other healthcare professionals in Denmark. So, at the time when I applied, it was a bit long process. It took me around 15 to 18 months for the whole process to complete. But the things have been compacted right now. It takes around 6 to 8 months for the whole process to get completed, and it's not that difficult to go through all those things.
Okay, and as we know that you have recently moved to Denmark along with your family as well. So was it, let's say, a little bit more complicated? You feel that if you would have just moved alone at the start, or was it okay to move with your family as well?
No, it was very much easier to move with the family, and the process was also very much simple. I just needed to apply for a visa for my husband. That's it. There was nothing else that I needed to do to bring my family along, and definitely it's not that difficult. It was quite much comfortable for me to come with my husband when I moved here, rather than if I have moved alone. So definitely
Okay.
it was quite easier.
Perfect, perfect. And how long was the process that really took you from, let's say, your first day to being here in Denmark?
Well, I applied in August, I guess 2022, and I moved here in March this year. But there was some time lapse in between that I took a gap in between myself because I had my FCPS exam in February, so that's why it took 2 to 3 months extra. But overall, it takes around 15 months. That was the total time period that took from the day one to till my arrival here in Denmark.
Okay. And as per our knowledge right now, and from our experience, because we have been helping a lot of people in terms of their global mobility, moving people from Latin America into the Europe, from Asia Pacific region into Europe as well, and then likewise. I think there had been, of course, delays in the past few in specifically between the time of 2021, 2022 because of Corona. Right now,
Yeah.
the time period that it takes is around 8 to 10 months that you can really
Yeah.
plan your move.
Yes, exactly. Because the applications were piled up after COVID, so definitely it was taking longer time. But right now, it's maximum of 6 to 8 months that takes for the whole process to complete. Because they are
Okay.
actually working on it very quickly.
Okay, that's perfect. One of the things that in Europe, because most of us have been now living in Europe for the past several years, one of the biggest challenges that we face, besides healthcare, is the housing as well. So there's a lot to do on the housing side as well. How difficult was it for you to find, let's say, accommodation in the start, or how did it went?
Well, that wasn't that much difficult because there are very authentic websites that you can visit in order to get an accommodation. And we did the same thing when we were moving from Pakistan. So we did our study while we were sitting in Pakistan and we looked on different websites to get an apartment. And then there were some people who were here as well who helped us in order to find accommodation as well. But it wasn't that difficult. It took that much time. It wasn't that difficult.
Okay, and one of the things that we of course face when going to a new country, this could be, let's say, either coming from Pakistan to Germany to Denmark, or let's say even people who are let's say German nationals going to Pakistan. So there are those cultural challenges that you always face, when you're moving around in the world. What was your first impression of the culture? Were there any difficulties that you faced as well? If you could just share experience around that.
Uh, no, it wasn't that much because I have been to France for like 1 to 2 months previously, and there it was very difficult to have a scarf or even a niqab, and that was very much people were very much offended with you. But since I have been here, I have felt that people are very much comfortable with whatever you are wearing. They're very open, and they're basically very welcoming people here, and they allow you to practice whatever you want to do. So that's not that much difficult when you are in Denmark.
And that's really good to know. That's, I think, it's really something that we can associate with our culture as well. And specifically, let's say in Scandinavia, because that region is known for let's say the happiest people in the world as well. And then there are specifically those elements that requires that could facilitate, let's say, people. And then, of course, like, I think people can have cultural shocks in different countries. I think within our own country as well, if you move from one region to another region,
Yeah.
those things can happen.
Yes,
No,
that's a
perfect.
fact.
And I believe, specifically, let's say when we talk about Germany or in Denmark, I'm sure like there are languages that are spoken in every country, a diverse language portfolio that we see. So how do you see that? How are you coping up with your language in Denmark? What are your plans around that?
Okay, one of the very good things about the Danish people is that most of them know they can speak English. So, especially in your early days when you are here and you don't know Danish, it's quite easy to communicate with them because at most of the places, especially the government offices, and even if you visit the public places as well, they are able to communicate with you in English. So that's not a problem, but definitely it's a requirement that if you're moving to Denmark, you need to learn the Danish language as well. So I have taken admission in Danish school and I'm working on it to learn Danish language as well because that is
Okay, that's
something that is needed for the authorization process and to work as a doctor as well.
okay, that's good to know. And when we talk about, let's say, the exams specifically, and this is related to the language side as well. So first, if you could just tell us that what the exam that you have to, is there any exam that you have to take? Because as you mentioned that you have already done your bachelor's in medicine from Pakistan, then you have done your FCPS as well. So do you need any specific accreditation that you have to do? And if you have to take an exam, so that exam is in English or it's in the local language?
Okay, while moving from Pakistan to Denmark, you don't need to give any exam basically. When you're moving from there, it's basically based on all the qualification that you have already have. They will assess that qualification and then they will give you the residence permit to come here and work as a doctor. Now, when you are here, you need to learn the language first, and then there is an exam that is based on the very basic knowledge that you have got from your MBBS. That is an exam that you have to give in order to work and practice here as a doctor. But the main requirement that we have is the language. You need to have a good grip on the language before you start practicing. Otherwise, the other exam is not that a big problem.
Okay, perfect. So it's primarily, as we already see, let's say in Germany as well, in different European nations, it's the language. If you really
Yeah.
cope that up, then I think everything really goes smooth.
That's basically something which is needed for a doctor to have a good
Of course,
communication with the patient as well. So that is the
100%.
main requirement that you need to have when moving to Denmark. Otherwise, it's not that. There's no other
Okay,
such.
great. Of course. And when do you plan to take your exam now?
Basically, we moved at a time when it's basically summer vacations in Denmark right now. The month of July is the month of summer vacations. So, inshallah, they will end by August. I'll start going to the school and the time when I will get prepared, I'll definitely be going for that. Maybe in 6 months to 1 year.
Perfect. Okay, that's good to know. So now, right now, you are enjoying your summertime in Europe. How does it feel to be in Europe in the summers?
It's good compare, especially comparing the weather of Denmark to Pakistan. It's definitely a very good experience.
Okay, it's definitely not too hot. These are mild summers.
Yeah, the summers are mild. It's usually a bit of the weather is more like if people from Pakistan have joined. So the weather is more like the winter season in Islamabad. It's similar to the summers in Europe. So that's the
Okay.
best thing that I'm enjoying right now in Denmark.
Perfect. Thank you so much. Thank you so much, Dr.
Okay.
Mariam, for sharing those insights. Then we will come back to you once again. Just moving on to some of the other interesting topic is I would now speak with Dr. Noor. Thank you, first of all, again, for joining in, for taking the time out. I believe you had a long shift today as well. So we would just like to now include you into the conversation as well. So tell us, our audience as well, that how does it feel like to be working as a doctor? You have been working in Europe for past well over 8 years. You have bred in Europe as well, living a long time. So tell us, how does a normal doctor's day look like?
Well, it's definitely good. You are definitely, you have a lot of work-life balance. They really focus on the fact that you can also have your time with your family. So it's not only like staying in the hospital. There is like lots of work-life balance included, and A lot of opportunities. If you are working in anywhere in Europe, in the European Union, you can relocate anywhere literally with no much problem. Like, for instance, I have done my medical degrees in Romania, but my degree is recognized in Germany. I didn't need to take any further exam or anything. I could like immediately start working there as well. So yeah, it's definitely great.
Okay, so a lot of opportunities to work with good work-life balance. That's good to know. One of the things that we would of course talk about that Dr. Mariam has mentioned as well in regards to the language. So, what how do you see that? How is it any different from, let's say, Denmark or Germany? Do you how important is the local language in Germany?
Very important. I think this is actually the most important thing. If you learn German, then you're all set. So I don't think it's possible to just use English language or something in the hospitals. They really require it. I mean, it's of course. I mean, you need to communicate with the patients somehow, and mostly the patients are older age, and they don't really know English. So German is definitely something very important.
That's of course, like, I think it's more of is an important aspect while working as a doctor, as you mentioned, like, when you are speaking with a patient, and then if they can only speak, and as we have seen from the statistics that Jihun presented as well, that in the next few years we will see a lot of people going into that higher tier of age bracket, and Germans, as per as the people in Danish, Denmark, Norway as well. So those can only speak, let's say, well, they can definitely speak English as well in many instances, as we have seen. But when you are probably, like, sick, not in the best mood, then you would not want to struggle a lot and would want to communicate in your mother tongue, probably. Absolutely. That's good to know. One important aspect that Dr. Mariam touched upon as well, it's about the acceptance in the society. We
Yeah.
would like to know from your side, how does it feel, how it is in the workplace side? So how diverse are the workplace? How do you feel that, are there people only working from German background, or these are people working from different nationalities?
It's very diverse. So in some places, I would even say that there are more foreign doctors than German doctors in certain areas in Germany. But yeah, of course, if you go to a very small village somewhere, you would find mostly like German doctors, but generally it's very diverse. Yeah.
Okay,
And
that's
they definitely also want and accept you, because there is shortage of doctors everywhere. They really rely a lot on the foreign doctors.
okay. That's good to know. One important thing that you mentioned right now. So, if you would go to a village, and then you would have, let's say, probably a hospital there, or let's say a clinic or something like that. So, tell us about how does a local hospital in a village look like, and what are the facilities there in those villages? Would these be villages as we see probably in the developing countries, or these are really modern villages?
No, they are definitely modern villages. There is no you have everything you need here. It's nobody will require like everywhere there's electricity, everywhere there is good internet. It's not really like in a first world country or something like this. It's a village in the sense that you don't have so many people around, and but then still you have all the necessary shops that you require, the doctors, the pharmacies, everything is there. So yeah, you can still have a good life in a village if you like nature.
Okay, so we would only call, let's say, probably a location a village, mostly because of the number of people that are living there. Unlike, and that is primarily because of, for instance, if you would do a comparison, so Germany has a population of 80 million people, Denmark has a population of 50 million people. But if you would go into the Asia Pacific region, so just to give you an example of Pakistan, so you would have a population of well over 220 million people. India would have a population of 1.3. It's now 1.4 billion people. So then, of course, their definition of village and the definition of a village really changes. It's in Europe, the village is more around like number of population, and then the if I would say that it won't be wrong to say that a village could have, let's say, a population of between 2,000 to 10,000 or even less, and those are just neighborhoods in the Asia Pacific region. So a neighborhood in a big country, in a big city, would even have more than 10,000 people. So, but as you mentioned, that on terms of the facilities, those locations are not lacking anything.
No, not at all.
And what about the hospital? So, would it be, let's say, too different to work in a hospital that is, let's say, in a small town,
Yeah.
than, let's say, a big city? So, what are the major differences when somebody wants to choose that? Okay, would they want to work in a community hospital, or in a big hospital? So, what should be considered?
Yeah, so I have done both. I have worked in a small village, in a small, very small hospital, and I've worked also in a very big hospital in a big city. So the difference is just that the small hospital would not be able to diagnose and treat very specific cases. We would, like in the small hospital, we would send patients to more bigger hospitals to get more treatment done. It's just that. So we would be able to do the basics, but we would not be able to do very specific treatment options. That would be only done in bigger hospitals. In bigger hospitals, you have all the departments, you have all the facilities that you require. That would be the difference. It's also, of course, the workload. The workload in a smaller hospital is lesser and logically more in a bigger hospital. It's exactly, these are the two main differences.
Perfect. And if you would like to know that, what are the number of working hours? So the number of working hours per week differ as well, working in a smaller hospital than in a bigger hospital, or those are the same?
So the working hours, you can choose yourself how many hours you want to work. In general, if you work full time, then it's a 40-hour week. This is the general aspect. You can, if you have family, for instance, or kids, then you would probably don't want to work 40 hours a week. Then you can just make negotiation that you would want to work only 30 hours a week. You can be very flexible as to how much you really want to work. So, and that applies for big hospitals, small hospitals, and as well clinics. So it's a very flexible thing that you can choose for yourself.
Okay, that's really good to know. Talking about opportunities, so now you have been working for several years now in the healthcare sector. You have finished your specialty in internal medicine. Now you are pursuing your career to being a cardiologist. We wish you very best of luck on that sense. How do you see opportunities within Germany, first of all? If you have, let's say, gained one specialty, or if you want to, let's say, pursue a specialty, how do you see the opportunities on that side?
Well, there is actually so many opportunities. You can choose to continue working in a hospital to further specialize in a certain field. You can choose to go to a small clinic and see patients out. Yeah, you can still see me.
Yeah, absolutely. We can
Yeah.
see you.
Okay, so there is just so many opportunities in that regard. So it's very individualistic and flexible, as I said also about the working hours. Yeah.
Okay. And how do you see that the opportunities, let's say, across Europe? So if somebody have, let's say, done a specialty or gained a degree in Germany, how do you see, let's say, the mobility of working, let's say, in Denmark, or let's say tomorrow Dr. Mariam decides to work in Germany? How do you see opportunities on that side? Besides the language, of course, thing, but just to know. Hello. Sorry, we cannot hear you. It's okay. Unfortunately, we had some technical issues at this point in time with Dr. Noor, but that's okay. We can, of course, take that questions in the question and answer segment as well. Um, I will come back to Dr. Noor in a while, and then we can probably move on to one of the interesting. The next topic is about future prospects of healthcare in Europe. So, Dr. Mariam, I'll come back to you once again. You have recently finished your FCPS, and now you have moved to Denmark. Could you share us that how, first of all, what was your why it was Denmark, or let's say why not other country in the US, in Middle East, or any other region within Europe? So why Denmark?
Okay, one of the main reasons for moving to Denmark was, as it was previously mentioned, that for UK, USA, even UAE, you have to give an exam before moving to that country, right? But for Denmark, you don't need to give an exam when you are moving here. So it's quite easier. The process is quite easier. That's why I choose Denmark. Because otherwise, if I have moved to UK, I would have to give lab. If I would have planned to move to USA, I would have to give USMLE. Second most important reason for coming here is like I have already done FCPS in pediatrics from Pakistan. So I can get that degree recognized here without going through the whole process of training in Denmark, which cannot be done in like say let's say UK, USA, and other countries. So that was basically the reason why I chose to came here, because I didn't wanted to waste the 4 to 5 years of residency that I did in Pakistan and the exam that I gave in Pakistan. So it was pretty much an easier option. That's why I choose to come to Denmark.
Okay, perfect, perfect. That's good to know. And in terms of I'll touch about some of the futuristic topics as well. Before that, I would just like to know one more thing for our audience. You know, these questions, because we have received a lot of applications from people from across the globe, and this is let's say not only from the South Asian region. And we have compiled, like, you know, those list of questions to ask. So one of the questions that I would also like to know is that, you know, once you have, let's say, done your exam, once you have finished your exam after getting your language done, so how does that process looks like of working with a specialist? I believe in Denmark you have to work with a specialist for some time.
Yes, definitely. You have to, like in Pakistan, you have to work under a supervisor. So that's quite similar here in Denmark as well. There is an introductory position that is being offered to you when you have completed all their requirements. Then you will work for a certain period of time under a specialist, and after that, you can work as an independent consultant here. Either you can start a
Okay.
clinic or you can work in a hospital.
Okay, that's good to know. That's good to know. Um, I'll touch upon a very interesting topic as well. This would be interesting for some of our listeners, and or probably most of our the listeners. So a lot of industries have been impacted on artificial intelligence, AI. We have been seeing different technological advancements. From Sperton, we had recently conducted an extensive study upon this as well, where we assessed the impact of artificial intelligence within different sectors, you know, and how it will impact jobs. So I would like to know from your side as well that, you know, how do you see that? Would there be, how does the healthcare profession looks like in the near future?
I don't think the AI would have a major impact on healthcare sector because we do have right now we have robotic surgeries that are going on, but still there are a lot of things that need human resources rather than an AI, artificial intelligence, and all that stuff. So I don't think in the near future definitely we will have positive impact of artificial intelligence, but I don't think that will impact our jobs and our profession that much as in
Okay.
getting job relating to that.
Okay, no, that's good to know. It's I think there are some of the areas within, let's say, healthcare as well that are considered to be impacted, but I think it's a long way at this point in time.
Yeah,
There's still like,
there's a lot in
there's a
healthcare that won't be impacted by the artificial intelligence.
Yeah, of course. Like need doctors to show empathy,
Yeah,
uh, to
yeah,
to to give that, like, humanly feeling to the patients that, okay, you are just not being treated by a machine, but there are people who care for you. I think that healthcare specifically, and the education sector as well, specifically, like, you need teachers who can show that affection to children, healthcare doctors, nurses, everyone who are supporting the entire infrastructure. So you need those people to see around, when you are not doing well
yeah.
in terms of your health.
Yes,
Okay,
that
no,
is
that's
for healthcare. This is something, the empathy or sympathy is something which is the core of our profession, and that is something that everyone expects when coming to a doctor or a nurse or going to the hospital. So these things cannot be replaced by the artificial intelligence. So definitely, the doctors and the other healthcare professionals will be needed in long run.
perfect. Perfect. Good to know. One thing that I would like to know from my side as well. So now you have done your FCPS in from Pakistan. So what specialty are you considering to choose? How do you see yourself in the next 5 years?
Okay, well, I have done my FCPS in pediatrics, so we'll definitely moving to something, some subspecialty related to pediatrics as well in the next few years, likely, inshallah.
Okay, that's no. We wish you very best of luck. We are really glad that you had a very streamlined journey towards Denmark, and we wish you more success in the near future. Once again, and thank you so much for taking the time out. Unfortunately, I can see that Dr. Noor had some technical issues, and then she is not here. But we will stick around for a few questions that we have. I think several questions that we have received now so far. So we will look into those questions and try to answer from best of our knowledge as well. But before that, what we would do is that we will start with a quick introduction about Sperton, that who we are, what we are doing, and how we are trying to facilitate in the healthcare sector. So, a quick introduction about Sperton. We are a management consulting firm, and we are helping our clients in terms of finding the right talent, getting them on board, managing the complete employee life cycle. We are headquartered in Norway. We have been operating in the space for well over 20 years. We have our offices in the US, multiple locations within Europe. As right now, I'm speaking from Germany. I'm based in Kassel. It's an hour drive from Frankfurt. Jihun, my colleague, is in Bremen. Some of our colleagues who has supported this webinar, they are based in different locations within Germany. Multiple locations within Germany. We have offices in Asia Pacific region as well, and in Latin America. And as I mentioned that, we have been supporting our clients in terms of finding that right talent, because there's not only struggle within the healthcare sector, there's a lot of struggle in the energy as well, because we need to see the energy transition, meet those targets of 2050 net zero. So there's a lot going on that side as well. This is where we are supporting in several industries, but a big focus right now is on the healthcare, that how we can address the challenges in the next 20-25 years that are coming, how we can bridge that gap that the public institutions, that the private institutions are seeing, and where the talent is. And this is where we had done our extensive research as well. So we are looking into global recruitment. We are helping in terms of people management. This includes different aspects of human resources. We are helping our clients. This includes organizations as well as talents in terms of their global mobility. Because a lot of times companies are trying to expand into different regions. This is where we are supporting them as well. And many times there are people who are, as individuals, want to move into different locations as well. So we bring that expertise into helping people relocate to different regions as well. In terms of business support, these are different elements that we are supporting organizations as well. So moving on to some of the aspects that we are helping our clients. This includes the organizations as well as individuals in terms of visa immigration services, relocation services, in terms of finding, let's say, housing, in terms of finding those basic things that has to be done in terms of tax and legal compliance, logistics, compensation, benefits, and all of that. One of the values that we really bring upon is that we have a very data-driven approach. So anything that we suggest, it has to be backed by data. It has to be not just based on, let's say, just emotions. It has to be seen that, okay, what the market is looking like, and that is basically driven by a lot of analytics. As Jihun has showed in the earlier part of this webinar as well, that how do we really see that this is becoming a challenge? There are several indicators that are pointing in the same direction. So how we can address those challenges. In terms of our within our company, we are a very much diversified organization. As I mentioned, that we are headquartered in Norway. We have offices in Germany, in the UK, in US, in Asia Pacific regions, Latin America as well. So we bring in that cultural diversity within our team as well, and this really helps us to understand what different markets are, what are different cultural challenges that people can face. So, for instance, Dr. Mariam, you have recently moved from, let's say, Pakistan to Denmark. How we can help you, and how we can help the people who will be moving in from those different regions, which areas they should focus on, how they can cope up with the language. And this is where we bring in those expertise as well, knowing that within our team we have a very diversified culture. Moving on to some of our clients as well, this is where I think the conversation, of course, gets interesting as well. So we have been working with a lot of global clients, some of the household names like Siemens, Hitachi, Wärtsilä in the energy sector, Becton Dickinson, again Siemens in the healthcare sector as well. So we have been actively working with Becton Dickinson, with Siemens, for their global roles. This includes roles in within Europe as well, out of Europe as well. But specifically within Europe, you would see that Siemens, Becton Dickinson have been working for many years on lab automation, on lab diagnostic machines. Some of the big machines that we see on MRI, on CT scans, these are developed by these big corporations. So we have been supporting them on local and international level as well. So a long list of clientele that we have successfully delivered, and trying to still bridge that talent gap. So that was a quick rundown about Sperton. I think now we would like to open the floor for any questions that we have from the audience. I'm glad that there have been pre-questions that we have received as well that we could answer through this webinar. Since we are conducting this webinar on a German European time zone, so in different regions we have received applications from the US, from within Europe as well, from Asia Pacific region. So there are people sitting in different time zones. And that's why, we would have already taken those questions that we would answer through this webinar. Now we would be looking at some of the questions that we have received from the audience that is here at this point in time. So I think one of the questions that I have received is around pharmacists. So what are the demands for pharmacists? Or let's say, if I would answer this question, and of course I would like to include Dr. Miriam on this as well. So we have received questions around different specialities, different functions within the healthcare sector. So do you think, while doing your research, that only doctors or nurses are needed, or there are different faculties as well that are required?
Well, no, it's not just about doctors. They have opened a whole lot. As you have already mentioned, there are a number of sections within the healthcare which they are taking applications, and they're calling the candidates from those. For example, let's say the Denmark is open for nurses, it's open for physiotherapists, it's open for dentists, it's open for dental hygienist. But then there are a number of fields that can be that you have already mentioned, that there was a slide that was already shared. So all of them are the applications are open for all of them to submit to the Denmark Patient Safety Authority. So it's not just
Perfect.
about doctors.
No, I think exactly. This is Yeah, sorry, please go ahead.
One thing specifically I want to mention is they had an update in their system. So right now they're not taking applications for pharmacists, but other than that, the all of the fields that you have mentioned in the health, they're taking applications for all of them.
Okay, that's good to know. So what we have, of course, done our extensive research upon is this is of course like data driven in the sense that what are the needs right now as well, and how we are seeing, let's say, in the next year, next 5 years, next 10 years, next 20 years as well. So I think it's really important to see that if, let's say, there is not a need at this point in time, is specifically, let's say, in this month, in the next quarter, but we will have that need coming in the next few months.
Yes.
So it's
Yes,
really important to see that.
that's definitely an up. They made an update in their website in this month on 1st of July. So in that update, they have removed prescribing pharmacists from the non-European countries, but previously they were taking them as well. So hopefully in the next 1 to 2 months, or maybe after 6 months, they will open the vacancies again.
No,
So
perfect.
right
Good
now,
to know. And this is where I think Sperton, as our team really looks into those updates as well, and make sure that the requirements are fulfilled. And this is where we are working with our partners as well. That okay, how we can really support in those needs.
But
Secondly,
one thing I
yeah.
wanted to add is if Denmark is not open for the pharmacists have a very easy open path in Norway. So that definitely comes within Europe. So we can try for that as well.
Of course, absolutely, absolutely. Um, and I think this is where, for instance, our presence, that global presence really helps, and the research team really strives and make sure that we are providing that. Then we have some questions about, I would say, processes that how do you initiate the process? So I would like to answer on that sense. In terms of the further application processes, so we have received, I would say, an overwhelming number of applications. I would say just as we launched this program, so we received in the first few hours hundreds of applications. Then of course we had to make sure that a fair chance is given to everyone, and then people who have that qualification, who have that experience as well. We do a very intensive check on that, making sure that we give opportunity to everyone and help them really go through that entire process. Um, so we are definitely in that. We have done that process, and this is the reason that we decided to conduct the webinar as well, to take on those questions and answer those questions. In terms of the application process, so what we would be doing is that after this webinar, we will of course be sharing a recording as well. So for people, because there were people in different time zones, so they can have the liberty to watch the recording. Plus, we will be sending across a follow-up email on the next steps, that what should be done, and how we can initiate the process for your journey to Denmark or different regions within Europe. So we will mention the next steps. That should not be a problem. We will get back to you with a follow-up email upon the next questions. Then we have specifically questions around hiring in Germany as well. Jihun, I think we have covered that, specifically the requirements that are in the German side. Would you like to comment on that? That how do you see the requirements for nurses coming in Germany, or how do you foresee requirements of healthcare workers as well?
To put it simply, Germany is hiring for nurses, and especially because they have, as I showed you guys before, a very high shortage in not only doctors but also nurses and healthcare employees all around. Germany is within the next 20 to 30 years, according to them, expecting around a 250,000 healthcare employee shortage, and this has to be remedied one way or another. And the way that they're going about it right now is that they have several different programs running, such as several different programs running in order to facilitate this process for foreign nationals. But also we are here in Sperton are also trying to address this shortage by this entire talent mobility process along with you guys.
Perfect. Thank you, June. Then we have received a question specifically around. So I'm trying to address first the questions around different faculties. So we have received a question around biomedical engineers, biomedical for biomedical hubs. I think I can definitely share an experience around this as well. In terms of, let's say, biomedical engineering, or let's say lab automation, or let's say lab engineering, microbiology engineers, microbiology scientists. So there's a lot of requirement around those roles as well, specifically in Scandinavia, in Europe. One of the experiences specifically is for one of the clients that we have been recently working with, Becton Dickinson. So they have a presence in more than 140 countries. They have been extensively looking for a lab automation engineer, a biomedical engineer, and people who have specialty in microbiology. And I can tell you that, for the past 1 year, they have been really struggling to find people around that competence. So there is a lot of demand. There will be a growing demand around this. I would suggest that, people, and we can tell as well that from the first analytics that we run from the applications, the hundreds of applications that we have received. So there were a number of people who have, let's say, their specialty as pharmacists, a number of people who have their specialty in biomedical engineering, in lab automations. There's a growing demand. There's still a demand, and there will be demand as well in the near future. So a lot of opportunity, positive employability that we see from our side, and this is our existing clients are telling as well, and this is what we foresee as well in the future. So that was one of the questions. Another question that we have received is around nutritionists and dietitians as well. Dr. Mariam, if you would like to take that as well, I can comment as an initial point that yes, this is one of the areas as well where there is demand. Dr. Mariam, if you could please comment on nutritionists and dietitians.
I definitely have to specifically check, but I guess both of them are also open for applications in Denmark. You can apply for as a dietitian and nutritionist in Denmark. I don't exactly know the procedure in detail, but you definitely know. You might be knowing comparative to me because I'm a doctor and don't have much knowledge about it. But these two professions are definitely open.
No,
And you can
perfect. And I think if I will have to comment on this, and probably Jihun from his extensive research can add to this as well. So you would have there are dynamics that have been changing over the past several years. So as we saw that, there are different people who are moving on different diets. There is food scarcity in different regions. There are advancement in food technologies as well. When we are striving to increase, let's say, life expectancy. So this has to come from a nutrition's point of view as well. If you have an aging population, they will require a different diet than that is required from, let's say, an infant. So there is a lot of demand on that side as well. Okay, so those were some of the questions around specific specialities, and then we have, of course, covered the topic around, okay, what could be the next steps. So as if I would like to add one specific thing as well, as a next step, we will, of course, share across an email, a follow-up email with all the details, the next, how we should start the application process. In between that, we will, of course, be taking 10 minutes call as well for the candidates who would be selected for the next round, just making sure that we get to know as well, and discuss those individual details while planning your move to Europe, because there are all of those small details that we need to make sure that we ensure that our the candidates who are moving, the clients who we are working with, so the journey is as smooth as possible. So we will, of course, be discussing that over those introductory calls. Then we have, I think, questions around, of course, dentists and public health professionals as well. This is included on the list that we have shared. So those are, of course, required. And there was a specific slide that we shared around on the doctors. that how there's a increased demand in all of those hospitals, and those doctors included the dentists as well. So there's of course a increasing demand for dentists as well, specifically, and not only let's say regular dentists, but there were categories to dentists as well. Within our research, that we saw that there are different variations of dentists that are being required. Then I see that there are some of the questions around the salaries. In terms of the salaries, we have already shared a slide pack that shows a comparison of salaries within the UAE, within Europe, and in the US. For specific salary ranges, this we can discuss, like once we have those introductory calls, because I hope that all of you can understand that there are several regions within the EU, well over 28 countries, and there are variations within those regions as well. So we will not be able to, let's say, touch upon on every salary aspect, but I can definitely assure that as an economist, as an economist and as an HR professional, when we are looking at different compensation packages, this of course includes the monetary rewards as well and the non-monetary rewards as well. And when looking at the monetary reward, that means that includes, let's say, your salary, your bonuses, all of those compensation. In Europe, I can vouch that that is very much well in accordance of what your expenses are. So, for instance, because they consider, of course, the level of inflation as well. So it will not be like you will be compensated less and then you will be left with nothing. So there are those. It is very much well regulated in that sense as well, that people are compensated fairly and accordingly as well. Okay, so I think those were some of the questions that we have received. And then, of course, there are other questions as well. What I would do is there anything else that Dr. Mariam, you would like to add, or Jihun, you would like to add? Or I think one of the things, sorry, Dr. Mariam, please go ahead.
One thing I just wanted to add regarding the salary, that here, if you're working in a day shift, definitely the salary would be different. If you're working in a night shift, the salary would be different. They would be going to pay you for every extra hour that you will work in the hospital. And specifically relating to healthcare, if you're working in ICUs, if you're working in emergencies, you will be paid extra. So definitely there is a variation in the salary, so that sum up amount cannot be given for that, if that was a question.
No, perfect. That is really an interesting aspect that you have mentioned, in terms of, let's say, a fair compensation, first of all, and secondly, compensating as per the number of hours worked. So there will be no hours that you have worked and that will not be compensated. That is, of course, we can assure, while being in Europe, that any number of hours that you have worked, that will be compensated accordingly, fairly, as you have rightly mentioned as well, that for the night shifts, for the weekend shifts, you will have different allowances. And yeah. Okay, and then so there was one of the questions that has that we have received, that a person who have done specialization as a dentist, and will it be beneficial for someone to move to Denmark? I think that really depends on where are you at this point in time. So, for instance, if you are, let's say, just example, like if you are currently in Norway and you are moving to Denmark, then I would probably comment that it's probably the same. But of course, if you are, let's say, in Pakistan at this point in time, or in India, or let's say in Sri Lanka, then that could be a possibility that you will have the quality of life is definitely different that you experience in your home country. You will have a lot of learning opportunities that I can vouch for. And of course, there will be better employability conditions as well. Then we have a question around specifically, okay, how to manage expenses in Denmark while living there and preparing for language and licensing exam. Would you like to comment on that, Dr. Mariam?
Yeah, sure. Basically, the what I have felt, it's been 2 months here in Denmark. The life is quite easier and it's very easy to manage the expenses. Definitely, once you are here, your main target is to focus on your language skills, and then you will do a part-time job. And it's literally not that difficult to earn a good amount from a part-time job and manage your day-to-day expenses. And if you have a partner with you, like if you're moving with your family, your partner can work full time, he can earn a very good amount, and then it would be very much easier to manage your living expenses. And it's not that difficult, even if you're moving alone. And if you have your partner, your family with you, then it would be more easier because you have one person who is earning as a full time, and you can work as part time, or you can even not work, and with the help of your partner, you can achieve your goals. So it's not that difficult to manage the living expenses.
Perfect. Thank you, Dr. Mariam. And I think I can comment on that as well. So we have at Sperton, we have a lot of some of our colleagues who have been studying full time as well, and they have been working on part-time jobs. So on a monthly expenses level, you can definitely cover that from your part-time job. While focusing on your studies, we would always encourage for people who are relocating that the first priority is to get your, let's say, certification done. If you're moving on a, let's say, a study visa, so you get your studies done, because in terms of, let's say, earning, you will have a lot of opportunities in the present as well and in the future as well. So the focus at this point in time should be, okay, you get your studies done, and then you get your full-time job. We have received one more question specifically that I would talk about is an insistence on from someone who has mentioned about the scope of physiotherapists specifically. I can comment on that, and of course, Dr. Mariam, you can add to that. So, as we have shared the list of people who professions within the healthcare sector that are required, physiotherapist is definitely one of those as well that are required. And I can tell you from, let's say, my understanding is that, physiotherapists, of course, are required for people who have, let's say, undergone a difficult, let's say, accident or something. But then you require a lot of physiotherapists or physiotherapy for people who are elderly, who are in that age. And as we see that, in Europe, from Jihun's research, that in the next few years, right now as well, a lot of people, population will be moving into that upper tier of elderly people. So the demand is only growing for physiotherapists. So there's a lot to that. Dr. Mariam, if you can would like to add something to that.
One thing I wanted to say is definitely it's in demand. That's why they have opened such an easy path for the people to apply now. If physiotherapy was not in demand, they would have closed that application. If they have opened that application, definitely they are in need for those. They are in need for physiotherapists and other people, because definitely there is a shortage of healthcare workers here in Denmark. And one thing more I wanted to add in the previous question is that I have seen people who are students here who had to pay their fees by the end of the semester. They are with their families here. They are studying. They are doing part-time jobs. They are managing their families, and they are living a very good life here. So it's definitely not a much difficult thing to manage your expenses, even if you have to pay a good amount in your fees. And concerning the doctors, we don't have to pay any fees. We just have to earn and just learn the language. Even the medical exam that you have to give after you are done with your language, that is totally free of cost. The learning language is totally free of cost. So definitely there are many positive things while moving to Denmark. And regarding the second question, physiotherapists are definitely in demand.
Perfect. Thank you. There's one of the questions that is how to secure a job in Denmark. Um, I can add to that, and then of course, Dr. Mariam, please share your thoughts on that as well. So securing a job in Denmark, so there are two phases to that. So there's first of all securing a job while you are learning your language, while you are preparing for your exam. That's your first part. And then the second part is once you have, let's say, received your, once you have given your exam, and once you have, let's say, gone past through that language phase, that is your second part of, let's say, securing a job. Um, from my experience, and this is experience coming in from a lot of people that we have helped, not just in healthcare sector, in engineering sector, people moving from different regions within Europe. Different regions within Europe means like, in Germany, in Europe, in Scandinavia, in France, Belgium, Netherlands. Um, both at both the stages, you should be able to find the job. So you would not face a lot of difficulty in that, provided that you have done your degree right, you have learned your language, you have given the exam right, because as you see, as you would be able to see that, in the presentations, that there is a lot of demand in terms of the healthcare workers. So once you have given that exam, that connection to working in the public sector or in the private sector. This is where, of course, Sperton helps as well. But these you will be already approached by a lot of employers as well, and that gets sorted out by itself. In terms of during your phase, while preparing, while studying language, while preparing for exam, there are multiple options of where you can work. Dr. Mariam, if you can comment on that aspect as well.
Yes, exactly. One very good thing that previously the healthcare worker, the people who were coming from healthcare sector, they were not allowed to do job while they were on authorization process during that authorization process. But there has been an update from 1st of July, and currently all the healthcare workers who are coming here, they are allowed to do job. So it's not difficult to find job in Denmark. Definitely, you can work. You cannot work as a doctor or as a pharmacist till you are done with your language. But there are a number of jobs which you can do where your English language expertise will help you. And definitely, once you are done with the whole process, you will not have any difficulty in finding job. They will give you a time frame like 6 months to 8 months, and maybe a year, where you can apply in different organizations, different hospitals, and you can search for the job. And from the experience of the people that have got who are already here, they found job within a month or two of completing their process of authorization. So it's not that difficult.
Okay, no, that's good to know. One of the questions that we have received is what is the time span we get for preparing for the license exam? Is there a deadline that once you have reached in Denmark that you must take the exam within that time, or you can take the exam as you like?
That's basically the visa that is issued to you. That's for a period of 3 years. So in this time frame of 3 years, you have to at least do the language, right? And once you are done with language, then you have a time period of around 2 years or 3 years, maybe. It depends on the expiry of your visa. So you have that time frame to pass the exam. But usually,
Okay,
most
no.
people are able to do that. You basically
Okay,
have a
perfect.
period of around 5 years in which you have to do the language, and then you have to pass the exam. It's a time frame
Okay,
of 5 years.
perfect. And just to understand that, will there be a local person who actually helps in this exam, or you have to really do it by yourself? You have already touched upon that, the exam is not, let's say, too extreme. It's a basic medical exam, but if you can just add a little bit more about that.
Uh, there is basically when you get through your language, you get yourself registered for the exam. They will give you a link for a portal where everything is available. Even the past papers are available from where you can prepare for the exam. And that exam is basically related to the basic medicine and the basic surgery that you learned in your MBBS. So they definitely provide help for passing that exam. It's not like you have to do it by your own. They will give you the link for the past papers, for the books, and each and everything. I guess there's a single book that you have to study, and you have to study the past papers. And after studying those past papers, you can easily pass that exam.
Okay, well, that's good to know. Um, Yeah. So then we have received one of the specific questions. This is around, let's say, finances involved in the process of transition and application. So specifically around finances or commercials, we will get back in terms of, let's say, the follow-up email. But I can touch upon that because a lot of people will have this question in mind. So when you are moving to a country, One of the important thing is that the host country that is hosting you, for instance, in this case is Denmark or Germany or any, they just want to make sure that once you are here, you have enough to survive in those first few months. You have enough to, let's say, pay for your housing. You have enough to have food on the table. So you just need to make sure that you show that okay, you are able to survive, and not really, let's say, land in Denmark or in Norway or in Germany and you would not have anything to survive, because of course they cannot let somebody be on the street or, let's say, homeless. So they just need to make sure that you have um, um, those finances to cover your initial stay. Then we have, there's one question around, we are running out of time. I'll just quickly come to some of the questions. There is a question around, let's say, licensing exam. Is there a fees or experience that you have must have to apply for the licensing exam?
No, it's totally free of cost. There's no fees that you have to pay, and no experience is needed. Even if you have done your house job, you can give that exam. Even I guess without house job, you can also give that exam. So there's no fees,
Okay.
no experience needed.
Okay, that's good to know. Then again, we have one of the questions around respiratory therapists and paramedics. Yes, I can tell you that these roles are also included as well, because these are covered in, let's say, the emergency side. So those are covered as well. Then we have questions around specifically, okay, around consultation and application fees. Again, as I mentioned that, we will not be touching upon on any of the commercials at this point in time. This is specifically a webinar to ask any questions that you have around if you want to ask that, how is the living conditions in Denmark, we can of course answer you those questions. How, if you have questions around your specifically healthcare side, so we can answer those. Thank you. Then I think this is all. We have received a lot of questions, but there was enough time. But we would, of course, like to thank every one of you who have attended this webinar, make it a success, have been able to participate during this conversation, had made it more lively. As the next steps, what we would be doing is that we will, of course, as I mentioned, that we will be sending across a follow-up email with all the details that, how we can help you go through this journey. And then we will, of course, guide you through the next process. Oh, once again, thank you, Dr. Miriam. Unfortunately, Dr. Noor is not here now, but thanks to her as well, and to all the participants. Thanks to Sperton team. Thanks to Jihun and the team who has put down all the research for making this a successful event. Thank you, everyone.
Thank you so
Cheers.
much.
Bye.
Thank you. Bye.
Bye.